Welcome to Deny Delay Depose, Health over Wealth.
Hey everyone, glad to be here.
Hi, excited for today's chat.
So I guess we should dive right in. It's been a wild couple of weeks, hasn't it? This whole Mangione situation, it's just blown everything up.
Blown up? I think it's more like the dam finally broke. I mean, this has been brewing for years. The blatant disregard for human life by these insurance giants, it's sickening. And Mangione, well, he's become a symbol of that frustration, a martyr even.
Whoa, hold on, a martyr? Seriously? We're talking about a guy who allegedly committed murder. I get the frustrations with the system, believe me. The deductibles are insane, but to call him a martyr, that's a dangerous road to go down.
I think it's understandable why people are feeling that way, even if I don't agree with his actions, obviously. We're talking about a system that's designed to make profits for insurance companies rather than actually taking care of people. We need to optimize for human beings, not for shareholders and bonuses. Look at the number of people going bankrupt because of medical bills, being denied coverage for treatments their doctors have recommended. The system is fundamentally flawed.
Exactly. And it's been flawed for decades. And now you have this perfect storm of technological advancement, growing public outrage, and the audacity of, well, what Mangione did that has shaken the establishment. The healthcare system as we know it is about to get a radical makeover.
I really disagree on radical makeover. That's just hyperbole. It is what it is because of the environment we live in. The government doesn't fund enough research, pharma companies don't give things away. Insurance companies have to pay out for everything that's covered. And there's just not enough money floating around to provide everything free of charge to everyone. It's the world we live in. The system is fine given our current environment.
Fine. People are rationing insulin because they can't afford it. Families are choosing between groceries and medication. Is that fine? No. The environment argument is a cop-out. It's not about a lack of money, it's about where the money is going. We're spending billions on administrative overhead, executive bonuses, and fighting claims instead of investing in preventative care and ensuring everyone has access to basic medical services.
And that's where things like decentralized governance come in, right? The topic we're supposed to get into today. We need to talk about how decentralization, using blockchain or DAOs, could disrupt the entire system. Instead of these massive, profit-driven corporations calling the shots, we could have a system where the people, the patients, have the power. We could track costs, we could verify medical records, and we could vote on where funds go, all transparently.
Okay, but let's pump the brakes for a second. Decentralization sounds great on paper, but who's going to handle the massive data sets involved in healthcare? Who's going to handle the regulatory hurdles? We're talking about people's lives here. You can't just slap a blockchain onto the problem and expect it to magically fix everything. Plus, you will have to pay for the infrastructure and manpower to maintain this. I mean, who's going to handle that? The taxpayers? We're all already paying quite a lot.
That's fair. It's not a magic wand solution. Absolutely. But it's about shifting the power dynamics. Think about it right now. Insurance companies are basically opaque entities that hold all the cards. They decide what's covered and what's not, and they fight every claim they can. With a decentralized model, even a hybrid one, we could potentially create a more transparent system where decisions are made collectively. It's about breaking the old silos and democratizing the control.
Yes, and it's not just about transparency, it's about efficiency. Think about all the administrative overhead that could be eliminated with smart contracts and automated systems. No more endless paperwork, no more long phone calls arguing about pre-authorizations. This could cut down on costs and provide better access to quality healthcare, and even free up doctors and nurses to focus on what they're supposed to do, taking care of people.
But that assumes that everyone is going to be tech savvy enough to participate in the system. What about the elderly or people who don't have access to the internet? Are they just going to be left behind? And who's going to be the ultimate authority? If everyone is deciding through voting how to distribute funds, won't it just devolve into special interest groups pushing their own agendas? I mean, we're humans and we are flawed, and the system is what it is because of our human flaws.
That's a very valid point. We can't just assume that this will solve every problem with the snap of a finger. But I think it can't just be a complete free-for-all, either. There needs to be some level of government oversight, or maybe even independent groups that provide guidance and support to people using these decentralized platforms. And that would help the tech-illiterate people who are in need of this system. You can't just leave them behind.
And it could be a gradual implementation. Maybe start with specific areas, like drug pricing transparency or medical record management, and then expand from there. We don't have to flip the switch overnight. Look at how blockchain is being used in other industries already. It's streamlining supply chains, verifying transactions, and ensuring data security. There's no reason why healthcare can't also benefit from those same technologies.
Okay, but it seems like you are still ignoring the fundamental question of cost. The blockchain infrastructure is expensive. The developers that would need to build and maintain this system are not going to work for free. And then you need the computer power to run the network, which requires a ton of electricity. Who's going to pay for all of that? We're already saying the system is expensive. Adding another layer of complexity that requires advanced computing capabilities seems silly.
That's a fair point, but think about it in the long term. Right now, we're paying for a broken system where a huge chunk of money is lost to administrative waste and profit margins. If we can streamline operations, cut down on fraud, and eliminate the layers of middlemen, we could potentially free up resources and redirect them towards actual patient care. And the initial costs of setting up the infrastructure, the investment, would pay off in the long run.
Yes, and also there are different models of decentralization. It's not just about a public blockchain where anyone can participate. You could have a consortium model where a group of hospitals, clinics, and patients co-manage the network. This would allow for better control and cost management. And also there are different types of blockchain. Some are much cheaper and energy efficient.
Okay, that's slightly less terrifying. But what about the inherent volatility of crypto? I mean, if these tokens used to manage the system suddenly plummet in value, won't that impact the whole system's solvency? And the lack of regulation of cryptocurrency can make it quite dangerous. What if a malicious actor gains control of the tokens and manipulates things?
That is a key concern, and also why it shouldn't be just one token. If it's implemented, it needs to be a diversified portfolio of tokens. Not everything will be equal. It needs to be a system of risk and reward. I would also assume that governments would need to introduce oversight. But at the very least, with a public ledger, it would be significantly harder to manipulate than it is right now in the shadows, in private server rooms where no one has visibility.
Exactly. And it also brings up the issue of data ownership. Right now, our medical data is scattered across different databases, with insurance companies and healthcare providers having access to it. With a decentralized system, we, the patients, could own our data and control who has access to it. It's about taking back control, especially with how lax security has been at some of the main providers. There have been so many data breaches recently.
I mean, I agree that data security is an issue, no doubt about it. But we're really going far down a rabbit hole here. We're not just talking about a slight change to the existing system, we're talking about a complete overhaul, a revolutionary paradigm shift. And from the outside looking in, it's just too disruptive.
Well, we're not saying it will happen overnight, but it's important to at least have the conversation and think outside the box. If we just keep doing what we're doing, we're going to keep getting the same results. And the system we have is clearly failing. I mean, the Mengione situation, even though I don't condone the actions, is a symptom of this widespread dissatisfaction and desperation people are feeling.
It's also about empowerment. People want to feel like they have agency over their own health, and right now, that's not the case. These big corporations treat patients like numbers on a spreadsheet, and this system could give them back the power they deserve. It's about healthcare, not wealth care.
But you're still not addressing the logistical issues. How do you coordinate emergency services in a decentralized model? What if a patient needs immediate care and the decentralized network is slow or unresponsive? Who makes the decisions then? We need a system that's fast and agile, and the bureaucracy of a decentralized model does not look appealing from that perspective.
That's where you would need to integrate the best of both worlds. You'd need to maintain centralized emergency care infrastructure like hospitals and ambulances, and a decentralized layer for data management, payment processing, and patient empowerment. So when you arrive at the hospital, they can access your medical records quickly and efficiently. They'd be able to receive payments as quickly and efficiently. It's about integrating, not replacing entirely.
Exactly. You could have smart contracts that prioritize emergency cases or streamline the referral process. And it's not like the current system is perfect. People die every day because of delays in care, misdiagnosis, and bureaucratic red tape. So we're not saying we're trading a perfect system for something else. We're saying we have an opportunity to build a better system, something that optimizes for the individual first and the dollars second.
Okay, but what about accountability? Who do you sue if something goes wrong in a decentralized network? When there's a clear hierarchical chain of command, like with an insurance company or a hospital, it's much easier to place blame and initiate legal proceedings.
That is a challenge for sure, but the lack of accountability is what is plaguing the current system as well. The hospital system has a bunch of legal loopholes and layers that make it hard to hold people responsible for neglect and mistakes. With a decentralized system, you would have some accountability. The public ledger could potentially make it easier to track where things went wrong and who is responsible. It would be easier to hold people and institutions accountable.
Yeah, and we could also integrate legal frameworks into the smart contracts. So you could have predefined protocols for dispute resolution. And we also need to focus on building strong communities. Decentralized models can foster a sense of shared responsibility and collaboration. So patients, doctors, and nurses are all working towards the same goal, health.
Okay, I guess there are ways to tackle the issues we've been mentioning, but it all seems very utopian and highly unlikely. I don't see it realistically happening in the near future. Not with the current state of technology and not with the way things are politically. There are too many special interest groups benefiting from the current system, and they will fight tooth and nail to keep things the way they are.
That's probably true. There's going to be a lot of resistance from these legacy institutions that are deeply entrenched. But we have to believe that things can change. We have to be persistent and keep pushing for these reforms. The technology exists. It's just a matter of the collective will to implement it.
And sometimes, unfortunately, it takes drastic events to create the necessary momentum for change. The Mangione situation has certainly brought the topic to the forefront, and I think this is just the beginning. We're going to see more and more people questioning the status quo and looking for alternative solutions. The system is shaking, and it needs to. This is not an option, but a necessity.
Well, I still think it's a long shot, but I do appreciate hearing the different sides of it, and I'm always open to learning. I think the issue is so complex and so rooted in everything we are as human beings and how we manage our society. I really do not see a radical makeover happening. It may be just wishful thinking.
Well, we'll have to see how things unfold. Thanks for keeping an open mind. That is always key to discussing solutions. It's a big problem with many complex facets, no doubt about that.
Definitely, and I think this conversation was very important. I think we got a little bit into the details of how the decentralization model can shake the foundations of this system. I'm excited to see what the future brings.
Likewise, I always learn something new when I talk with you guys, but I am still skeptical of this whole revolution, but hey, that's me. Until next time.